operations. I'm going to cover a majority of the slides today. Deputy Commissioner Biba. But the predominant theme here today is going to be covering billing of the supplemental payments that we've recently received approval for in the state plan amendment for the COVID emergency. So this is certainly good news. We've been waiting quite a while for this to come along, so we're happy to present this information to our ICF providers who have been caring for individuals since the onset of the pandemic. So this is certainly some relief from the financial perspective that is long overdue, and we're happy to be presenting this information to you today. Okay, this first slide really just gets into the authority for what we're referring to as supplemental payments. Effective March 18th, the emergency SPA establishes a supplemental payment to fund the provision of ICF, IID active treatment during daytime weekday service hours. This is aimed at individuals who were unable to participate in day treatment or their ICF day service programs. This includes vocational services, the ICF vocational services program, where these services were provided by a different agency because that agency closed or was not able to serve individuals due to the pandemic. This is very similar to the exercise that OPWDD did with individuals that were in the IRAs that couldn't attend there are day programs operated by other providers where we allowed group community habilitation R to be used to offset some of those costs. So this is very similar in terms of the way that we're setting this up. The second bullet here, this is to be done in accordance with the individual's authorized levels not otherwise captured in the current ICF IID rate setting methodology. This essentially means that for those individuals that prior to the pandemic were at your ICF during weekday daytime hours where those services were already being rendered, this is not really applicable to them. This is applicable to the individuals who normally were going out to day programs that were operated by another OPWDD provider. Okay, in terms of availability, the supplemental payment will be available to ICF providers until the earliest of the following: the end of the public health emergency, at such time when the outside treatment facilities are permitted and able to safely resume operations at a sufficient capacity, or when revoked by OPWDD. These stipulations were expressly written into the state plan amendment, and they're specified there. But these are the periods of time that this will be available to our ICF providers. Okay, so this slide gets into the reimbursement amounts. The fees are being set up based on OPWDD rate setting region, and they align with the corporate headquarters of the operating agency. These fees align with existing ICF in-house day service reimbursement rates. OPWDD doesn't have a large volume of ICFs that currently bill for this, but these are those reimbursement fees that are going to be available for our ICF providers to bill for those weekday, daytime hours that individuals were at the ICF. Okay, claim submissions. This is where we're getting into the meat of the presentation here. The claims will be submitted, as I just mentioned, using the existing rate code for in-house ICF IDD day services. Like we've done for other initiatives under the pandemic, we're indicating that a particular revenue code is used to help identify that the claim is an ICF IID supplemental payment. You'll see it down below. It's the 0242 revenue code. That's really the indicator that's going to help us identify that these billings are associated with this initiative. The SPA only allows for the payment of claims using the 4108 rate code when there is no other ICF IID day service claim billed on that day for an individual. So in circumstances during the pandemic, if supports were able to be provided or pushed into the ICFs and they were billed to Medicaid, these claims are not going to process and pay because it's going to recognize that there's another claim for an individual on that particular day. This is strictly for individuals when they weren't able to get any supports or services that were billed to Medicaid for day services on a particular day during the allowable period. So the rate code is the 4108. The provider ID is the multi-service provider ID that the day services are all billed under. The locator code is the 065. The effective period aligns with when the day programs were closed, March 18th of 2020. And as I mentioned, the revenue code that should be input on the claims is the 0242 revenue code. Okay, because we're going retroactive, obviously there's claim submissions that will be over 90 days old. Delay reason code 15 can be used on any claims that you submit that are beyond the 90-day timely billing requirement. This particular delay code is corresponds to the pandemic. It's a natural disaster delay code that is being used for delays that are associated with the COVID pandemic. So that's the delay code for any claims over 90 days that you'll put on your submissions. Providers will have 60 days to get the retroactive claims submitted. We've worked with DOH. They've agreed to extend the normal 30-day timeline to 60 days. So this essentially, gives us 2 months for providers to get their claims prepared and submitted to Medicaid for payment. The deadline based on that 60-day time frame is going to be July 31st of 2021. Okay, so for the fee load, as I mentioned before, currently we have a very small number of ICF providers that currently do in-house day services and have the 4108 rate code active. DOH is proceeding with the rate load, and you will be notified upon activation. OPWDD has sent the information to DOH for them to load this. They have what they need, so they will be proceeding with the fee load of the 4108 rate code for those providers that do not have it. This third bullet is really important. As you await for the notification, you should begin preparing your claim files for eligible individuals now. So even though you're waiting to be able to submit the claims, because we're limited to a 60-day time frame, we just ask that you get started right away in terms of preparing the retroactive claim submissions, because we will be limited to 2 months in terms of getting claims back to March of 2020 into eMedNY and adjudicated for payment. Okay, I just whipped off my slides very quickly. The other one thing I did want to mention before turning this over to Abiba is that we referenced that we're loading this to the multi-service provider ID. We do have a couple of agencies that don't have the multi-service provider ID. For those agencies, we will be loading, we're asking DOH to load the 4108 rate code to the supervised IRA provider ID. I'm going to send an email to the executive directors and the CFOs of the two agencies that they should expect to be submitting these claims under. I'll get that out to you, if not this afternoon, early next week. But again, we have to, before submitting your claims, you have to wait until DOH has the fee loaded and you get your notification from the health department saying this has been loaded to your provider enrollments. Okay, and I'm sure we'll have time for questions at the end on this, but I'm going to turn it over to Abiba to take the last couple of slides.
Thank you so much. Good afternoon, everyone. So I will be speaking specifically to the billing standards and service documentation. So all ICF IDD providers must continue to document your active treatment services that have been provided to individuals during daytime hours. The CFA, or the Comprehensive Functional Assessment, must also be updated to reflect all of the service provisions during the COVID-19 public health emergency. Next slide. This next slide speaks specifically to the retroactive service documentation. I believe we have a question in the chat box about this. So for services rendered prior to June 7th of 2021, agencies must maintain a signed attestation. That attestation must include the fact that the individual was in the residence during daytime hours on any weekday that the ICF IDD supplemental services were billed, and the agency staff provided active treatment services to the individual in the residence during those daytime hours. So those two specific points must be included in the signed attestation. Next slide. So Earl, I will turn it back to you for this last slide on questions to send claims.
Okay, I think we'll open it up and take some questions.
All right, before we begin the question and answer portion, I just would like to remind everyone that a recording of this webinar will be posted to the OPWDD website early next week. And with that, Elena, what is the first question?
The first question was this rate code uploaded by the Department of Health?
Okay, so as I mentioned, there are some ICF providers that do have the in-house day service rate code loaded. I think it's about 15 of them. So there's certain agencies that already have it and have been authorized to do in-house day services. If your agency is doing that, you can certainly start billing right away. Most agencies do not have it, and that's where I was referencing that we have sent information to DOH to load the 4108 rate code. And you'll get formal notification from DOH when that's loaded to your provider ID. So most ICF providers do not have it. We do have some that do. But if you don't have it, you will get notification as soon as it's loaded in the coming week or two, hopefully.
Okay, thanks, Earl. Next question, does this include children in schools that were closed? Our agency does include units for active treatment for those in school when the active treatment surveys are requested annually.
So, great question. This is Kate Marley, and I'll take that. If you look at slide 2, it outlines the eligibility for these payments, and the eligibility is limited to individuals who are unable to participate in day treatment or ICF-IID day services provided by a different agency. So it does not cover children in school. It's essentially the same policy as was in place for IRAs in terms of their ability to access Community Have R. So it's a very similar program, and this is described in the federal emergency spot.
Okay, thank you, Kate. Next question, are there units of service limits?
No, there are not unit of service limits. This does differ with the Com Have R that Kate was just talking about. There was an exercise where we calculated allowable units. We did not do this here because we have edits in place that will essentially not allow a payment to go through where there's already been a day service billing for this population. So this essentially is allowing for any day that an individual who attended a different provider's day program and hasn't pushed those supports in or billed for those supports, it allows services to be billed back to the March 18th date.
Great, thanks, Earl. Next question, how can we get a copy of the attestation to send?
Great question. This is Kate. We are not developing an attestation. We ask that each agency develop their own, and it should include the statements that we had on the last slide that Abiba reviewed. Anything else you wanted to add to that, Abiba?
Hey, you've captured it. As long as the attestation contains those two components and is certainly signed by the agency, then that would be sufficient.
Great, thank you.
Okay, along those lines, are there any other, is there any other documentation that's required to document active treatment in addition to the attestation?
Yeah, Kate, I can take that one. So the individuals in the ICF have goals that, staff are certainly required to document when those active treatment goals are delivered. So there would be an expectation that those goals would have been implemented and staff would have signed off on that, including any daily notes that would certainly identify that the staff provided those services to the individual in the residence during those daytime hours when they could not attend program elsewhere. There's also an expectation, obviously, that the CFA be updated as well.
Okay, thanks, Abiba. Is there a deadline to file the attestation form?
The attestation form does not need to be filed. It needs to be maintained in the agency's record. And that's a very important document, obviously, because if there was a review of claims, you would want to make sure that, that record is maintained within your agency. So, but it does not need to be filed with OPWDD. It's for your own use. I would follow whatever procedures you have in place for maintaining documents related to claiming.
Okay, next question. Is this for billing our ICF individuals that attend other day hab facilities, or does it include individuals that attend our day hab facilities?
This good question. This is strictly for individuals that were attending another provider's day program.
Our expectation is that for same agency services, you had the ability to push services into your residence and deliver them there, and continue to bill those services. If that is something we need to, further discuss, please send an email to Central Operations and we can take a look at that. Or actually, I'm sorry, People First Waiver. We'll take care of a lot of it.
You can send it to both. That's certainly fine. We'll.
Okay, great. Are there plans to address ICF residents who participate in the same agency's day service?
I think that's what we just discussed, in that our expectation was where it's the same agency, that they would have been able to deploy staff or share resources like was done in the IRA for those day services.
Okay. Regarding rate code updates, those are sent by DOH via snail mail, correct?
Yes, you're right. They are. I think there's an auto generation to the correspondence address that's on file for your agency with DOH.
Okay. Do the data sheets have required items to be included? Person response, for example?
If you're referring to documentation, I think we're just generally saying that you need, and Biba, you can jump in, but I think it's a matter of making sure that you're documenting active treatment during daytime hours to support the claim that's going to happen, if that's what the question is, I think.
Okay, next question. Sorry, Biba, go ahead.
No, it's fine. I was just agreeing with Earl. I understand the question, the way in which it was answered by Earl. So if that's not the intended question, then I think we would need clarification.
Okay, thank you. Regarding the attestation, do they need to be signed, and who in the agency would need to sign the attestation?
I would suggest, as in any documentation that you maintain for a Medicaid claim, that it is signed. And I would suggest that it is a person who has authority over the program. We are not dictating who that is. It could be a program manager. It could be the executive director. I think we're leaving the form and format to each agency. So that's going to be up to you.
Okay. If the ICF was addressing recreation and socialization needs and taking the individual out into the community, can this count for billing?
I think it gets to the fact of whether or not there was a billing on that day. If this is active, if this is considered active treatment in accordance with what's in the CFA, I don't think there's an issue with it. I mean, again, the system is going to allow the claims to pay in the absence of another day service claim for that individual on that day.
Okay, great. For ICF residents attending site-based programs operated by the ICF agency, will they be eligible for this type of claim?
I think that's, again, that's sort of the same question that I think we've addressed. So the intent was that this program is really for the person, and it goes back to that slide 2, who participated in another person's day program. Where the person was in the residence and went to a day service outside the residence, we would have expected that the agency was able to deliver services in the residence and bill them under their day service. If that's an issue for anyone, again, send that to the 2 mailboxes there and we can take a look at it. But this particular claiming is limited to the definition in slide 2 as described in the SPA itself.
If the outside agency billed a day have retainer day, would that block our agency from receiving the supplemental payment?
Good question.
And we expected this question to come up, and that's why we didn't formally address it, but this is what we've done. The edits that will prevent services to be billed on the same day go into effect after that first month. So the first month when we allowed retainer days, you will be able to bill for the in-house day service in the presence of a retainer claim. So that's for that first month before we actually defined that the retainer days were specific to the waiver and under the authority of the Appendix K. So that's a great question. You can bill for that first month when we allowed retainer days for day treatment and ICF day services.
Is there going to be a CFR program code for this like there was for CHR?
That's a great question that I don't know the answer to, but I think we'll go to fiscal reporting and data analysis and get the answer to that for folks.
Okay. If a program is reopening and an individual and or their family decline to resume at this time, can the resident still bill for the supplemental payment?
Can you repeat that?
Sure. If a program is reopening and an individual and or their family decline to resume at this time, can the resident still bill for the supplemental payment?
That's an excellent question. I would suggest that the language was specific. If there is space available for the person, then this would not apply. So I would suggest at that point that that you consider what the service options are for a person. But I would not want to be in a position where and I don't think this is honestly the case, but the day treatment program is fully up and operational, 100% capacity, and, and the individual is refusing to attend. That would mean we have to really relook at the service provision person, but I would not be submitting claims for the person under this program at that time. And Abiba, do you want to comment? Do you think that's an appropriate response?
Absolutely.
Okay, great. Does medication administration count as a documented service during daytime hours?
I think the point here that we're trying to make is that under very special circumstances, the person is in the residence, they typically would not be. Your staff are providing services to them. If your staff are providing services to them during those hours and they are in the residence and in normal circumstances they would not have been, then you are eligible to submit a claim. Moving forward, we suggest that you document what you're doing in terms of active treatment during those hours, but really for the retrospective period, it's really that simple. So I would follow practice with the service documentation that you deliver as part of the person's active treatment and as defined in the CFA. And Abiba, I'm sorry, I should have let you answer that probably. Any changes?
No, it's fine, Kate. You nailed it. So thank you.
Okay. Does the agency need to be an OPWDD provider?
Yes.
Yes. So go back to slide 2. We're talking about the day program that the person did not attend because of a closure due to COVID. And we defined it there in slide 2. This is limited to people who are in your ICF and attended prior to COVID, day treatment, or an ICF IID day service, or ICF vocational service. And those services are delivered by an OPWDD provider. So the ICF IID day service is, typically when the person in an ICF goes to a day HAB program, but is receiving, obviously not a waiver service. Similarly for the vocational service.
Does each individual ICF have to have their own attestation, or can it be one attestation with each ICF identified in one document?
This is really up to the agency. You're maintaining it for your own, for your own records to document the past service provision, since we obviously got approval for this very late. I think either would be fine, but it's up to your agency to decide how best to document that attestation.
I work for OpenGate. We have an in-house ICF day program. Does this program allow us to bill for COVID flexible hours? For example, can we bill for a full day if services for 1 to 2 hours were provided instead of 4 hours?
No. And to be clear, what we're talking about here, well, actually, I'm sorry. Can you repeat the question?
Sure. I work for OpenGate. We have an in-house ICF day program. Does this program allow us to bill for COVID flexible hours? For example, can we bill for a full day if services for 1 to 2 hours were provided instead of 4 hours?
I think I would like to take that offline because I need to understand it, but I do want to be clear. Yeah, we'll have to take that one offline. What we're talking about today is the ICF IID supplemental payment for ICF. So let's take that other question offline. Okay. And if the person emails the addresses in the last slide, we can respond.
Okay. Does this include non-OPWDD day programs?
No. Folks need to go back again to slide 2. Very clearly, this, and it's identified in the approved state plan amendment with CMS, so this is an important piece. The person who is eligible for this type of claiming are people who attended day treatment or ICF IID day services or vocational services that are closed because of COVID and therefore receive services in the residence from the ICF staff.
Thank you. Our residents attended a DDRO program that closed in September 2020. Are we correct that we can only bill for the days that program would have been operational if not for COVID?
I would say yes, because if they attended the program up through September, the state day program would have billed, and the claims aren't going to go through because there's already a claim for them. I think I'm understanding that question correctly. Could you just read it one more time, Elaine? I just want to make sure I'm...
Sure. Our residents attended a DDRO program that closed in September 2020. Are we correct that we can only bill for the days that program would have been operational if not for COVID?
I think, yes. Then what I said is correct. Again, if an individual was able to get service and there's claiming for that individual, then these claims are not going to process and pay. They're going to kick out.
Okay. Are individuals who attended a senior program under the Department of Aging eligible for this support, as those programs were and remain closed? What about individuals who live in our ICF?
No, I'm sorry, this program is limited by federal agreement to individuals who live in an ICF and attend another OPWDD day program. So it's the day treatment or the ICF IID day services.
Okay, we have a couple of last remaining questions. If a person in an ICF went to the doctor from 9 a.m. to 10 a.m. and then received day services in the home, could they still bill for that day?
The question is, someone went to the doctor in the morning, returned to the ICF, and whether or not they could bill for the day service after they returned. That should be fine. There's nothing that would prevent that.
Okay. How would an ICF provider know if an outside day program billed for retainer days?
Well, the retainer days, again, after we're allowing the supplemental payment to process in accordance with a retainer payment for that first month. After that first month, there shouldn't have been a retainer payment billed. We didn't have authority for ICF or day treatment retainer payments after the first 30 days of the pandemic. So, but ultimately the claims would deny if you submitted them and someone else had also submitted a claim on that day. But again, we didn't allow retainer payments after the first 30 days for ICF day services or day treatment.
Okay. A couple of last questions here. At the beginning of the pandemic, it was unclear if they would accept day service billing if it was done in the home, so we didn't send staff into the homes. How do we handle the non-billing due to this situation?
Well, I think Kate alluded to that before, and I think if you send that inquiry into the mailboxes that we identified, I think we're going to have to assess that. We've had a couple questions on that already. The expectation was that supports were provided, and I think that providers were billing, but we may just have to take a look at that a little closer.
Okay, last question. To clarify, if one of our ICF residents who attends an outside day program, which is open, however, that person doesn't attend the outside day program, we can't bill for them if we are providing active treatment while in the residence?
I think this is saying that they could go back to the day program, but they decide not to, or can you read it one more time?
Yeah, I think that this payment is, let's go back to slide 3. Can we jump back to slide 3? So for all of the retro period, it's not really going to be an issue, or for the most of it, right? There's very few programs that at this point are fully operational. But at such time, you have to read the slide, and this is what you're going to have to evaluate in terms of the particular circumstances the individual is in. So the supplemental payment is available until either the public health emergency ends, which that's not the case yet, right, or such time when outside treatment facilities are permitted and able to safely resume operations at a sufficient capacity, or when revoked by OPWD. So it's at such time as there is sufficient capacity. This is language that CMS required that we put in the application because what they wanted to make sure was that people are not unduly limited from services outside the residence. So they were very clear on this. So if the person's day treatment facility, let's just take an example, is open, they are at full capacity, they can serve the person, and the person does not want to go, or the family does not want them to go, then no, you should not be able to bill this service. You need to talk to the regional office about what the person's service needs are at this point. But this program would not be available to you because of that clause. Doesn't mean that we can't think about other options, but it wouldn't be an ICF supplemental payment under this federal authority. And Abiba, did I say anything wrong?
No, that is accurate, Kate.
Thank you.
One last question here. It's a follow-up to the program that closed in 2020. The program permanently ceased operations in September 2020. Subsequent to that date, COVID or no COVID, there was no program for our individuals to attend. We are wondering if we could bill the supplement until we found a new program for them.
So I think this is a particular case that I'm going to ask the agency to, address to the email boxes, and we can look at it. I do want to be, the language in the SPA is targeted and clear, and I don't want anyone put in a position where, a claim wouldn't be allowable under these provisions. So in that instance, I think that's something that we would need to look at on a case-by-case basis.
Okay, we had a couple of questions come in last minute here. Can we bill if the client went home for therapeutic days?
No, because you're not providing service. Again, I think, you need to be providing something to the person on that day in order to claim that. So if they're home for therapy leave, you're getting the payment through the residential provider for that service, but you cannot bill an additional day of supplemental payment.
Okay, can you clarify how many hours a day you can bill for?
This is a per diem. It is not defined by hours.
Okay. I believe that's it.
Okay, terrific.
All right, thank you, everyone. A recording of this presentation will be posted early next week, and we will notify you when that is posted. Thank you for joining.